Hello, everyone.
Oh,
Welcome to Doctor's Health Talk Show. I'm Dr. Farhan Tahir, rheumatologist joining you from Philadelphia. And today, one of my dear friends, Paul Cybularz, is joining me. I have to tell you guys that Paul has been my friend for about 9 years now, and he has a magic. He is acupuncturist and practitioner of Oriental medicine, and we work together at a hospital in Philadelphia. We have now shared several patients by this time, and I actually been treated by him for my own cervical radiculopathy. So I want to introduce you to this friend of mine, and I want you to learn about what he does as an acupuncturist and practitioner of Oriental medicine. Paul, welcome to the show. How are you?
good. Thanks for having me. I appreciate it.
Paul, you do something that a lot of traditional medicine doctors don't know much about. A lot of public is not completely clear about the benefits of acupuncture and Oriental medicine or traditional Chinese medicine. But you chose this path, and there has to be a reason behind it, and I want to talk to you about it today. So let's start with your journey as as a practitioner of Oriental medicine and acupuncturist. Where did you get your training, and how did you choose to do what you're doing?
um, okay, well, so my path into this medicine is a little bit different than probably most of the people in the field. I, for a long time, I couldn't figure out how I actually got into this medicine. It's kind of strange. I knew about it at a time where I think a lot of people didn't. And I attribute that to actually my dad traveled to China a lot for his work. And he brought home like these old, they're like nine antique needles in this old school acupuncture. There's one that looked more like a scalpel. There's one that was like inches long. I mean, it was actually kind of a terrifying set of needles, but I thought it was a really interesting approach to medicine. Um, so time went by, and I kind of just always got into that, always into performance. I always thought maybe if I could like take ginseng, I would have some secret to be better at football than like my peers. So really, I guess it stems from being just ridiculously competitive. Um, but as I grew up, that kind of changed, shifted a little bit. So I went to college with the intention of actually going into medicine. Um, wasn't sure if I wanted to do Western medicine completely, if I wanted to be a nurse practitioner, if I wanted to be a doctor. So I started out with nutrition and pre med and thought I'd figure it out as I go. During that time, I was actually lucky enough to get in, I guess you could call it like an internship or at least shadowing, right? So I shadowed this physician at, he's at Jefferson now. His name is Dr. Yang, and he runs the Dow Institute. And Dr. Yang kind of let me shadow him, showed me how he treated his patients, and he actually was combining them both. He was doing traditional Chinese medicine, and he was also a practicing psychiatrist. So he did like a really cool blend with his patients, and I got to see how effective that was. And that slowly started reinforcing those childhood ideations of like, yeah, I kind of want to check this out. So I decided to do like 2 semesters of traditional Chinese medical school, and then I decided I would feel it out at that point and decide if I wanted to apply med school or just stick at that. And 2 semesters in, I was having some serious doubts. Okay, because Chinese medicine definitely has very old constructs woven in with the modern aspects of medicine. So like I did pre med, so my concepts of like viruses, bacteria, pathogenesis of any disease. And what I was learning now was kind of very much at odds, at least the way I viewed it at that time. And so I was about to drop out, and I had broke my lower back. So after the initial depression of this is terrible, I decided, well, this is a great opportunity to see how good Chinese medicine works. They wanted to do a Harrington rod. I had I had some severe damage, and instead I went and got acupuncture a lot from 3 different providers at my school. They gave it to me almost absolutely free. I got it 3 times a week, and in about 6 months, I was walking. I didn't have pain. We won't go into how I re-injured it again, like immediately after that. But long story short, that was enough to make me really become passionate about the medicine because I saw firsthand how effective it could be, and that gave me enough impetus to kind of push through my doubts.
So you decided to stay with this course on to
I did.
Oriental medicine. How long is this degree?
Depending on how you do it, it's anywhere from about 5 to 7 years. So typically, the reason I pause is because you should at least have your associates in the healthcare related field, and then you go and you do your bachelor's and master's at one college. Some people choose to do their bachelor's first and then do additional work. So it could be 8 years if you do your bachelor's and then a 4-year bachelor's master's combination. So it is a substantial amount of school.
Substantial. So almost same as other branches of medicine.
Yeah.
You also then added acupuncture as an additional, or is it part of the same course that you become acupuncturist?
So all of the, we'll call them traditional Chinese medicine degrees because it's kind of a catch-all thing. Pennsylvania calls it practitioner of Oriental medicine. So there are some changes in like the terminology, but essentially traditional Chinese medicine is a few branches of medicine wrapped into one, right? So it would be acupuncture and herbal medicine would be the 2 main branches. So if you studied both of those, then, for example, in Pennsylvania, you're a practitioner of Oriental medicine, which means you're board certified in herbal medicine and you're board certified in acupuncture.
Interesting.
Okay.
Tell me, so where did you go for your college?
So for college, I did my undergraduate at Drexel in Philadelphia, and then for my master's program, I did it down at East West College in Sarasota, Florida.
So now, since you graduated, did you have to go into some kind of internship, residency, or you just started working with somebody? How did the professional life start?
Yeah. So in my opinion, this is a deficiency of the way acupuncturists are certified and released into the wild, if you will. There is no official residency or internship when you graduate, but the amount of time that you're observed in clinic is pretty sizable. So, I mean, I think acupuncturists, when they graduate, are safe. It's just, as an acupuncturist, you're kind of thrown into the wild, and it's a little bit stressful. Fortunately, I still had that contact with Dr. Yang, and he kind of took me under his wing quite a bit. He helped me out. He kind of gave me the confidence in practice, and if I had any questions, I could always run them by him. So truly, that was one of the things I'm most grateful in my professional career.
So you have been practicing Oriental medicine and acupuncture, and you have dealt with quite significant, diverse population, I should say. You have worked with me in the cancer hospital. Mm-hmm. You have ventured into your private practice. Now you are collaborating with a couple other acupuncturists in Bucks County. You have gone to Florida also to practice. Tell us some unforgettable moments that actually made you fall in love with this profession.
You know, I would say every couple months, I typically have unforgettable ones that kind of like remind me how magical it can be. Because, you know, there's definitely a big spectrum of how people respond to acupuncture. And some it takes multiple settings, some you kind of blow away with the first visit. And it's very hard to predict who's who. I would say the first unforgettable one I had was a patient who I guess you would best describe as cervical radiculopathy as well. It was one of my early treatments, and she had neck pain for about 9 years. She was unable to rotate past like 15, 20 degrees. She was just frozen and locked up. And I remember in class, we talked about distal points in acupuncture, which are points that are far away from the site of the pain that by some mechanism of action seem to work on whatever area they're related to. So in this case, we treated her ankle. And it was very uncomfortable because she literally burst into tears. Uh, Me being a new provider, I was floundering at best. Like I didn't know if I should support her, help her cry, try to calm her down. So she's just bawling on the table. But I noticed as she was crying, she was moving her neck more. Like so she turned to the side to cover her mouth, and I was like, oh wow, like surprising, you know. I didn't say anything at the time until she had calmed down. She didn't know why she had cried. She didn't. She was not able to vocalize like, oh, I was thinking of something that happened. No, just massive amounts of tears. And after that, she was, I wouldn't say pain free, but she went from about a 9 to about a 2, and her range of motion was almost fully restored. And that was it. After that treatment, she had retained those benefits. She would come in every couple months for a tune-up if it would get tight again, and the same weird thing would happen. She would cry on the table, and we were good. So that was one of my most memorable that I think is safe for public consumption.
I have to say that I thought you were going to give example of me. I went to see you not too long ago with my neck barely moving because I had lifted the weights wrong. And after 2 treatment, I was 85% better. And after 4, I'm 100% better.
I would love to say that you are remarkable, more as a friend than as a patient.
Yeah. Wonderful. Okay,
now,
great.
If you had cried on the table and it was gone after one,
okay, I didn't make the list. I understand. So I have walked into patients' rooms when they had treated, they got the treatment from you in our hospital together. Mm-hmm. And they're like, he's magical. He did so well. Yeah, I feel so great. And people to this day talk about you. What is that uniqueness about you that that makes you different than other peers in your profession?
You know, I think the most honest answer would be I don't know. And there's many layers to it because I have thought about this and I have my working theories, but I definitely don't have any research to back them up. I think with acupuncture in particular, there is this element of rapport, right? And really kind of developing that trust with the patient first. And what I've noticed is when I'm very calm and when I'm very present and when we actually have a little bit of fun, treatments are remarkably more effective most of the time. You know, I wish I could bottle it up and make it reproducible across the board because for sure I have my great treatments and I have treatments that I wish were better. But I think objectively, I've heard that quite a bit. You know, I would like to believe it more, so I'd be a more confident practitioner. But it's always good to hear other people have still reported that back at the hospital.
Yeah, they do. They do. So I would say that you are a humble man, and I completely understand that it is probably your presence and being present at the moment is really what connects you with your patients, and you understand their problem and kind of apply your knowledge. You have worked in many settings. What is your dream job? How would you like to see this acupuncture or practice of oriental medicine applied?
I have like 15 answers to this question. Yeah. So I don't know if that means I have like multiple personalities. But as far as seeing acupuncture go to where I think it should be, can I shift it to that direction? Yeah. I would love to see acupuncture utilized where it's the strongest, and herbal medicine for that matter. So if I could find a position where we could get patients that were more interested in staying healthy and attacking things early on in their lives or their symptom period, that would be phenomenal, right? It's very difficult to push a patient back into balance and into wellness when, you know, they're diagnosed with stage 4 cancer, like we've seen at, the hospital we work at. So if I could see them when they're dealing with colds and a tight neck and trying to fix their diet and trying to fix their lifestyle, that's when I feel like personally I could do the most good in somebody's life, and that would be the most rewarding. But I think there's so many avenues that you can apply this, that any place where I can work with physicians such as yourself, where I can have my knowledge be intertwined with theirs, and then we can build both of our knowledge together. That excites me the most, medicinally.
Yeah.
I mean,
So more collaborative work where you have patients coming to you a little bit sooner
mhm.
and early on into their disease that actually could help them. Now, I know that you have worked with pain a lot, neuropathy a lot. Just give me a couple of other diagnoses that we could utilize in our chronic diseases that
Mhm.
it could benefit. So tell me any role in our most chronic medical conditions.
Well, I think a lot of conditions that people don't really associate with them being responsive to acupuncture would be things like anxiety, stress,
Yeah.
depression. Uh, and that's something I came to a little bit later on in me being a practitioner. You know, at first it was something I kind of wanted to stay away from because it's very difficult to objectively evaluate how somebody's going along that path, right? Anxiety is much more difficult to say I'm doing better or worse than shoulder pain, for example. But being where I'm at now, where I work with a lot of seniors, and being at this specific time with the pandemic, it's been interesting to hear how well some of them did with their anxiety when they were getting acupuncture and how challenged they are now that we had to dial it back during this time. And so that shocks me. And I mean, the Western mechanisms behind that, I guess, make sense because there's a lot of interplay with the immune system and opioids and kind of a bi-regulatory effect on like dopamine and serotonin, for example. So some of these patients that aren't responsive to meds have been doing very well. And I find that pretty interesting because it's something I've avoided for quite some time.
I agree with you. I know when I got treatments, the first few moments, what I felt was a sense of significant relief, intense relief, relaxation. And I used to tell you that, Paul, I felt very relaxed. And you said, yeah, this happens. It's a certain site where you do. So I agree with you that with COVID-19 and stress, I think acupuncture could be a great source to help people with less medicines, and more of this approach could help them. What do you see the roadblocks? Give me aspect of what you see in our health system roadblocks to bring acupuncture and oriental medicine, and what the people's or public roadblocks or perception of, a lot of times I've told you patients feel afraid of needles, and I said this needle is as thin as your hair. So tell me a little bit about roadblocks.
Yeah, I think there are quite a few. Just at face value, I think the Western medical paradigm of how research is done and considered to be superior or inferior is a particular challenge to acupuncture because there's so much that's involved. There is a placebo effect with any medicine, and I think acupuncture is no different. Kind of teasing that out from the research so that insurance companies are more on board is a really big challenge. Um, and I don't think there's an easy answer to it, except for the fact that the more people get it, the more people get informed, the more people vouch for its benefits. And you see this kind of slow organic growth of it that we've seen in America now. But the insurance component has a few levels because, for example, right now, people's wallets are stretched, right? And acupuncture in the US isn't necessarily cheap. Right? It's definitely something that people have to decide if they want to use to do to increase their health, but there's a cost to it. And some insurance companies are on board, and that definitely has lowered the barrier to treatment, for example, which I think is fantastic. But also, I think the profession itself is growing. It's growing up, if you will. There's a lot of different branches, even within Chinese medicine, right? There's Korean acupuncture, there's Japanese acupuncture, there's traditional Chinese acupuncture, there's the balance method, and then there's particular lineages. And in some way, shape, or form, they all seem to work, and they all.
Paul, I lost you for a second. We were talking about the different lineages of acupuncture.
Oh man, I have a better connection now. I was really on a roll on that one. You got me all excited about it. But yeah, so essentially what I was saying is the different acupuncture itself is still very fragmented. There's a lot of different ways to practice it. I think acupuncturists could do themselves a favor by really pouring our resources into finding, okay, we can treat back pain these 5 ways, for example. Which way is the most effective for this particular presentation, right? And we need to do that with not just the traditional Chinese medicine terminology of like qi, blood, yin and yang, but we need to look into where it's innervated and what specific changes we're causing in the brain and the local tissues. I don't think there's any harm in modernizing the concept of acupuncture and how it works. I just
very nice.
Yeah.
That's a very good vision. I know we have talked about sometime, but I want to talk to the viewers that there are some emergency rooms in the United States that have incorporated acupuncture at the point of care, especially for athletes who have injured their ankle or their knee, and rather than getting opioids or IV treatments of medications, they're evaluated, imaged, and then sent to acupuncture treatment, and with great results. So I think especially with opioid epidemics and overuse of medications as it is in our country, bringing acupuncture into mainstream is really important, and I think it would benefit everyone. Tell me a little bit about, so thank you for sharing your vision of acupuncture and where it should be. And there's always roadblocks for bringing out something which is not traditional. But give me a little bit about insight into your journey as a practitioner in this field and what made you stronger and resilient. Because you chose a path which you knew clearly had more resistance. Just you pursued on that. And what drives you to do that?
Well, I'm fairly stubborn.
Yeah.
And I think in the long run, that actually has served me well. I've questioned the decision a lot, and it does pop into my mind about how effective this is with, against, in conjunction with Western medicine. And because of that, and because of the kind of various ups and downs in public opinion and which research articles are coming out at the time, and which physicians I'm talking to, I've encountered a fair amount of resistance and a lot of sideways looks, but I've also met a lot of physicians that are incredibly just on board with it and want to see what it can do, and rather than being suspicious of it, are more curious. And that shift means everything. So like within the hospital that we worked at, physicians helped me do the research and actually look into it. And those kind of things have really kind of propelled me forward. And getting that buy-in and working with them and kind of seeing how that mutual respect can develop has really pushed me through a lot. Because when we started out, I would see patients that I don't feel like I could have helped then, and I didn't, and so for me as like a practitioner, without the insurance involved, the hardest part of practicing traditional Chinese medicine is giving someone a treatment where I cannot guarantee that they are going to do phenomenally, right? And as a new practitioner, your confidence is even lower than it will be, in 10, 15 years. So as I've grown and as I've more reliably, let's quote unquote say, fix things, then I feel much more comfortable charging a price that, allows me to eat, and also I know the patient can afford. So that's a really tough place for Chinese practitioners or practitioners of Chinese medicine to advance. There's no business classes really that are worth their weight in salt. So you're kind of left trying to evaluate your value and what you can deliver and what you can promise. And I would say that's honestly, for most practitioners, a very difficult part of the practice. It's one of the reasons why I love being integrated in a clinic at the same time that I run my private practice. So I like basically having a steady paycheck so that if I have a patient that can't afford treatment, but I want them to get better, I have wiggle room. I don't need that patient to feed me, so I can offer them whatever treatments they need at whatever cost they can do it at.
I agree with you, and it's thank you for being honest,
Yeah.
Paul, because these are real struggles. Because I agree with you that a patient has to be have the faith in the treatment and don't expect that it's a pharmaceutical drug that they will notice the difference right away. And but they have to also be open to the idea that actually it has less side effects than a lot of medications. As a physician, as a physician, we only talk about what the patient is going to get the benefit, and we tell them to go and read the side effects on their own, because we don't have the time to go over them because there's so many. And be honest with you, it's just awareness that need to bring more and more about this benefit of this treatment. My question for you is a question that I think about it, how hard it is for a non-traditional oriental practitioner to learn or understand the benefits of acupuncture so that they can embrace it more wholeheartedly. So if you were to do a little course for physicians at your practice to learn some basics of acupuncture, what do you see that course should look like for them to learn from a practitioner? Now you've been practicing, I would say, like over 10 years, right? So you could essentially.
Now I feel old. Let's gloss over that part. But yeah, actually, it has been over 10 years at this point. So
I know. So because I've been with you for almost 8-9 years, and so what I want to tell you, what I want to ask you is how hard it is for a non-oriental doctor to learn basics of it.
Well, so the answer you're going to get from me is probably very different than what many in my field. I don't think that a lot of doctors would have a particularly hard time understanding it if we speak the same language.
Yeah.
Right? So like if you spoke to me in Farsi for this whole interview, probably be a disaster in my responses, right? I would just kind of, and so I think a lot of acupuncturists do need to understand that if we are going to work with physicians, we need to share a common language, right? And I think that there are a lot of benefits that can be gleaned from learning the mechanisms behind how acupuncture works. That's how we can make it more effective. For example, like when we had in school, they told us not to combine coffee with acupuncture. You shouldn't have your Starbucks latte before coming in for a treatment. And it does have to do with how adenosine is regulated. And one of the mechanisms of action for acupuncture is the modulation of adenosine and how that's related to the pain receptors. So if you drink a lot of coffee, it kind of is slightly detrimental to the effects of acupuncture. So kind of learning these things is a big deal. That way you just don't say, oh, just don't drink coffee because that's what I was told. At least you can understand something behind why that's the case. So with physicians, you have all the physiology that you need to understand how acupuncture works. So really, we would just focus on how to get those results. You know, why stimulating this nerve or this point will release what we want to at least change somebody's immune system or change somebody's pain response. And then the rest of the course would really be devoted to getting the feel for it, because it's like surgery without being able to see what you're working on. So you want to be delicate, and that takes practice. But actually understanding it, if it's in your language, I think you guys already would understand it. If that
Wonderful. I like that. I can see that maybe in future we can work on something like that together. My another question is, share a life advice, a life principle that may help a younger yourself, a younger person who actually wants to follow this path, that may help them.
Doubt is toxic. It's as simple as the advice I give. The fact that you're going to run into people that doubt the ability of the medicine that you've learned is very challenging if you don't have that degree of faith. Um, that's why I think breaking my back was such an amazing thing, because it gave me enough of an experience to be like, nah, it works. Now I just have to figure out how to make it work better.
Yeah.
Right. And so when I taught, I taught for about a year and a half, and teaching those students, basically that was what I tried to instill. It's like, this works. When you get out, it's not going to work that great. Okay. You're going to have to practice. You have to find out these little fine tunings of how to actually stimulate that point to get what you want. But if you don't doubt yourself and you have faith, you'll have that wherewithal to weather the ups and downs, and you will become a good practitioner. And if you become good enough, you will be successful, because word of mouth will just spread. And that's been my experience so far.
So don't doubt yourself. Don't doubt the thousands of years of practice of Oriental medicine, but know the facts well, know your material well. Now, I would like to know a book, and if you don't have the name, you could let me know later, a book that you could recommend people to read about benefits of acupuncture from aspects of common ailments, that it could be written in a language that people can understand, so that they can improve about their understanding and more open to it.
Yeah, there's a few, depending on like the level that these people are looking into it. I think there's one, I'm not exactly sure the title. It's like a handbook of Western diseases, and it's written by Bob Floss, who's a pretty well-known acupuncturist that lived in Colorado. And he basically breaks down a little bit of the research coming out of China for how to treat like common things like angina or GERD or PCOS. And he goes into the pathophysiology from the Western side of things, what the Chinese medical equivalents are, and why you're treating it the way you're treating it.
That would be nice to know. So if you could research that and share with us, I'll post it.
For sure, link. I'll send that your way.
Okay. Any other piece of advice that you would like to share? We didn't go more into herbal formulations, but you are licensed to create herbal. So give me a little bit of intro on that, and we can talk about that later some other time.
I mean, the herbs we should do a whole separate thing on that. But I mean, herbal medicine was maybe my first love, actually, because that's what I was using to try to get like an edge when I was playing football. And then as that kind of grew into the martial arts, I started learning about, things like ginseng and the lore behind it. But, herbs are the original pharmaceuticals. And I think that Chinese medicine has kind of circumvented some of the ways we do research now, and it's kind of developed its own kind of way of fortifying the body, for example. So we're not just dealing with disease, but we're basically adding resilience to your wellness. So you can take a little bit more stress, and you can take a little bit more of a hit and still come back okay. And that's something I think Western or Chinese herbalism does that Western medicine has really missed the boat on, is adding resilience to your level of wellness, right? So for example, with this whole COVID-19 pandemic that started there, a lot of what China did with their herbal formulas is try to raise the immune system's activity, so boosting up natural killer cells. And there is actually a traditional formula that they modify to do that. I think the English name is the Jade Windscreen formula, but it's Hu Ping Feng San. And they did publish research that showed a decrease in the healthcare workers taking that. The ones that were taking that were less likely to contract COVID-19, working in the same setting with the peers. So it's really interesting stuff. The effects are so widespread that I think it turns a lot of Western medical practitioners off, because it's hard to pin down a single chemical that's doing it. There's 100, 200, 300 constituents in one herb, and Chinese medicine combines 12 herbs. So the way it affects the physiology is vast.
Wonderful. And I think I'm glad that you mentioned that, but because I agree with you that in a couple of years, maybe the research will come out of China, how they controlled the infection much better than the rest of the world, although they were the epicenter, and then America became the epicenter. Okay, wonderful. Paul, it's been a pleasure. We'll conclude this session and stay. Don't go too far. I have to record another session with you, which is the fun session, because you mentioned something about martial arts, your travels, and I want to know more about that.
This wasn't the fun one?
No.
Oh, okay. All right. Well, I'll just hang tight then.
All right then.